I just saw a video of a young lady who just found out that she has vitamin D deficiency. She's black, and she was surprised to find out that her melanin is part of the reason why she has vitamin D deficiency. So I wanted to talk about this because there's always a lot of issues around vitamin D, melanin, and sunscreen. So I want to talk about all of that in one and start by saying that if you're a person of African descent, then when you move to the northern hemisphere, you're going to have high likelihood of having vitamin D deficiency for a few reasons. Number one, we are not outside long enough to have the conversion of vitamin D from our skin, right? We tend to cover ourselves. So for example, the lady I'm talking about, she was wearing hijab. So there's not enough surface area for the sun to hit your skin for you to get that conversion. You can get vitamin D from food, but we don't eat enough of the foods that contain vitamin D anyways to be able to get all of our vitamin D from food. So you need food and the sun. But if you're in the northern hemisphere, so Europe and North America, you're going to get less. There's a less likelihood of you getting vitamin D compared to like if you were in your country of origin. So I'm West African. So if I was in Africa, I don't have that issue per se because I'm outside all the time. But it's still an issue in Africa because of westernization and the way we do work now. So for example, more people are working indoors. They're not going to be outside as much as when they were predominantly doing work that was requiring them to be outside, like farming, for example. And so you will start to see a trend in vitamin D deficiency as well in people who are in those African countries. Okay. Now let's tie that back to to sunscreen. So why is it that we encourage you to use sunscreen in the northern hemisphere? The reason for that is that there's more UVA rays in the northern hemisphere than in the equator where we naturally are from. So for example, I'm from Cameroon, and the UVB index, which is the type of UV rays that burns the skin, is higher in that area, but my melanin protects me from getting burned in that area. And so when I'm in my country of origin, I get higher vitamin D and I have less likelihood to burn. And this is important because the fact that I don't burn is protecting my skin, but I don't have there isn't a high UVA index. And UVA is the type of UV rays that causes photo damage and it causes DNA damage to the skin. And so when you're in an area where there's a higher amount of UVA rays, you're going to get signs of aging that happen faster than someone who is in the equator or in their country of origin. You're going to get symptoms like hyperpigmentation if you get acne or any sort of inflammation to your skin. All of that is going to be more likely if you're in the northern hemisphere than if you're in the southern hemisphere. So it's kind of a tricky situation because, we want to glow. We want our skins to look good. So we want to protect our skin from that UVA because I'm in the US, so we're here in the northern hemisphere by choice or not by choice, and now we have to deal with the repercussions of that because if you're in the UVA area, you're most likely not going to be out enough to get the vitamin D that you need. There's not enough conversion of vitamin D where you live, so you are going to have to supplement. Okay, and this is usually worse in the winter time when again there's very little sunlight, and so you see people have a lot of seasonal affective disorder. Part of that has to do with low amounts of vitamin D in their blood. Okay, so I tell everybody to take vitamin D, especially if you're in the northern hemisphere. But if you're in Africa or in Central America and you never go outside, you may also have low vitamin D. So in general, if you're Black or a person of color, it's a great idea to have it checked. I recommend that you take vitamin D3 plus K2. They're fat soluble vitamins, so it's just better absorbed when it's with K2. And actually another caveat, if you are a heavier set person, like if you're not skinny, then your likelihood of having vitamin D deficiency is higher, because all the vitamin D that you have is going to be in your fat and not circulating in your system. So you definitely need higher amounts of vitamin D. But at the end of the day, if you go to get your physical, your blood work, have your vitamin D levels checked. Most Black doctors will check it, or most doctors who are cognizant of this fact will check it, because a lot of times people have like mood issues, anxiety, depression, all of that, and most of the time vitamin D is part of it, and so we always check that before we go prescribing any sort of medication. But preemptively, you can take over-the-counter vitamin D3 plus K2, especially now that we're going into the winter. So I hope that's helpful. So now you know why, we melanated folks need to take vitamin D. And if you don't want to take any vitamin D, you can get it from food, and you need to be outside a lot. And that's all I'm going to say about that.